If you're here, you might be in that strange postpartum in-between, where the baby's here, your body doesn't feel like yours, and the timeline you were expecting doesn't match the one you are living. You're someone who's capable. You planned for birth. You probably even had a feeding plan or a spreadsheet. But now you're weeks into postpartum and wondering, is this bleeding normal? Is this amount of pain okay? Should I be feeling better by now? And the worst part is that most of what's out there either sugarcoats it or make it sound terrifying. Today, I'm going to walk you through what postpartum recovery actually looks like, not by week numbers on a calendar, but by phases, because your body doesn't recover in a straight line, and neither should your expectations. This is the stage where everything feels raw, physically and emotionally. Whether your birth was smooth or traumatic, your body is in a state of major transition. Right after delivery, your uterus begins shrinking back down. That causes cramping, especially if you're breastfeeding. Bleeding, called lochia, is usually heavy and bright. You're sore, maybe have some stitches, and likely feeling overwhelmed. Of course, I would be. You're probably sweating more than usual. Your breasts are swollen or leaking. And you're trying to figure out how to feed a baby while sitting on an ice pack. On the emotional side, your hormone levels, especially estrogen and progesterone, drop drastically. That shift alone can make you feel irritable, weepy, detached, or like you're watching your life from the outside. All of that is part of the acute healing phase. The most important thing you can do in this stage is rest, replenish, and receive help. That's hard for many moms I work with, especially those who are used to doing it all. But this week isn't about proving your strength. It's about honoring the trauma your body just went through, even if you're grateful for your birth experiences. If your bleeding becomes so heavy you're soaking a pad in an hour, or you're passing clots larger than a golf ball, that is not normal. And you need to call your provider like right now. But otherwise, let your only job this week be healing and bonding. Nothing else needs your attention more than that. Now, you're in the stage where people assume you're feeling better. You might look more functional. You might even feel more capable. And that's when most moms overdo it. This is when you think, I'll just clean the kitchen real quick, or I'll go for a long walk. I'm feeling okay. Then the next day, you're exhausted, bleeding more again, or suddenly sore in places that were just healing fine. Your uterus is still shrinking. Your abdominal muscles are still separated. If you had a C-section, your scar is still in the early stages of remodeling. And if you had a vaginal birth, especially with tears or an episiotomy, that tissue is still vulnerable even if the skin looks closed. What many moms don't realize is that internal healing continues long after you stop seeing blood. In fact, that pinkish or brown discharge you're seeing now, that's your body still cleaning out the uterine lining and continuing its recovery process. Emotionally, this is when the fog can lift or thicken. You might feel more like yourself one moment and completely lost the next. You're starting to adjust to your new identity, but that doesn't mean it's easy. If you're finding yourself craving structure but have no idea how to build it, that's exactly why I created my free masterclass, 3 Steps to Actually Enjoy Postpartum Without Running on Coffee and Tears. I made it specifically for first-time moms who want something better than survival mode. In this class, I'll walk you through how to create a recovery plan that works with your life, your body, and your baby. You can find the link to register in the description. And trust me, it's one of the things I wish every mom had access to. So now you've hit that magical 6-week mark. You had your postpartum checkup, and you may have been told you're all clear for sex, for exercise, and for life to resume. But what if you don't feel clear? What if things still hurt? What if you're back at work but still bleeding? Or your core feels like mush, or sex is painful, or you're crying during your commute and cannot explain why? This phase is where a lot of women feel betrayed by the timeline they were given. The truth is that 6-week visit is meant to rule out complications, not to declare you are fully recovered. In this phase, you may start to notice signs that things aren't quite right. Maybe you leak a little when you laugh. Maybe you feel pressure in your pelvis when standing for long periods. Maybe your emotions feel numb or extra sensitive. These are not things to push through. They are signs that your body still needs care. Pelvic floor dysfunction, core instability, unresolved birth trauma, and even late onset postpartum depression often surface during this time. If any of these sounds familiar, it's not a sign that you're doing something wrong. It's a sign that you're in the thick of recovery process that needs more attention, not less. Okay, this final phase is the one most moms never even identify. It's the phase where everything looks normal on the outside. You're back at work, your baby's feeding well, you're moving through routines. But inside, you feel stretched thin. You might feel a quiet sense of grief, not because you regret motherhood, but because the version of you who used to feel sharp, social, or free is harder to access now. And because the support you had early on has faded. The texts have stopped and the help has disappeared. Everybody moved on, except you are still on it. If you're dealing with persistent physical symptoms like pelvic heaviness, painful sex, or abdominal weakness, that's not just mom life. It's a sign you deserve treatment, not toughing it out. And if you're feeling distant from your baby or overwhelmed in a way that doesn't lift with rest, or like you're just going through the motions, that matters too. You are still postpartum. You are still allowed to ask for help. This phase is where the true support, the kind that centers you, can change the whole story. And you're not too late for that. If anything in today's video sounded like what you're living through right now, I hope you'll take the next step and join me in that free masterclass. It's here for you. No pressure, no shame, just structure and support. Recovery is not a finish line. It's a process of healing, recalibrating, and rebuilding. And it deserves more than a 6-week appointment and a few well-meaning check-ins. You need to build forward in a way that reflects your real life, your values, and your pace. And that's something you don't have to figure out alone. If you're still pregnant or newly postpartum, watch this video next. It will give you the tools to prepare for this recovery before it takes you by surprise. Thanks for being here. I know this season asks a lot of you, and the fact that you're seeking out support tells me you're already doing something powerful for yourself. If this video helped make your recovery feel less confusing and more manageable, go ahead and subscribe so you don't miss what's next. And when you're ready for deeper, structured support, I've linked that below too. I'm Cherry, and I will see you in the next one.